Welcome back to Lab Talk, where we break down the science behind laboratory diagnostics and explore the incredible ways we can provide clinicians with impactful lab data. I'm Amber, and today we're diving into a fascinating hematology parameter that gives us deeper insights into platelet production, the immature platelet fraction, or IPF. If you've ever wondered how we assess bone marrow platelet production in real time, or why IPF is becoming a valuable tool for clinicians, this episode is for you. So grab a coffee, settle in, and let's talk platelets. All right, let's start with the basics. The immature platelet fraction, or IPF, is a parameter available on Sysmex XN-Series analyzers that may help clinicians evaluate bone marrow platelet production. Think of it like this. When the body needs more platelets, whether due to injury, disease, or normal turnover, the bone marrow kicks into action. It produces and releases immature platelets, which still contain nucleic acids as they undergo final maturation in the bloodstream. By measuring the percentage of these immature platelets, the IPF tells us how actively the bone marrow is producing new platelets. Pretty cool, right? Now let's talk about thrombopoiesis, the production of platelets. In a healthy individual, the bone marrow constantly produces new platelets to replace the ones that get used up. But in patients with low platelets, or thrombocytopenia, we need to ask an important question. Is the bone marrow responding appropriately? Here's where IPF comes in. If a patient has a low platelet count and a high IPF, it means the bone marrow is actively trying to compensate by producing more platelets. This suggests increased thrombopoiesis, which can be seen in conditions like immune thrombocytopenia, also known as ITP, or after recovery from chemotherapy. On the other hand, if a patient has a low platelet count and a low or normal IPF, this suggests the bone marrow isn't producing enough platelets, which could indicate conditions like aplastic anemia, bone marrow failure, or myelodysplastic syndromes, also known as MDS. So IPF helps us differentiate between platelet destruction and platelet underproduction, making it an incredibly useful tool for hematologists. Now let's take a step back and look at where platelets come from. Platelets originate from megakaryocytes, which are large nucleated cells found in the bone marrow. These megakaryocytes release platelets into the bloodstream, where they mature and become fully functional. Most routine automated platelet counts don't differentiate between mature and immature platelets, but that's exactly where IPF makes a difference. By using fluorescent flow cytometry, Sysmex's XN-Series analyzers can identify and quantify platelets with high nucleic acid content, which means they are still immature. This provides a real-time view of thrombopoiesis, something that traditional platelet parameters, like mean platelet volume, also called MPV, just can't do as accurately. Now let's talk about the science behind how the Sysmex XN-Series analyzers measure IPF. Fluorescent staining takes place when the IPF test is ordered. The analyzer uses a special reagent called fluorosil PLT, which stains the nucleic acids inside platelets. These stained platelets are then analyzed using fluorescence flow cytometry, which helps distinguish immature from mature platelets based on nucleic acid content. This method ensures that we get a direct and reliable measurement of immature platelets without interference from white blood cell or red blood cell fragments. The result? A highly sensitive and specific way to assess thrombopoiesis. So why should clinicians and laboratorians care about IPF when we already have other platelet parameters like MPV? Well, here's why. First, IPF is a direct measurement, while MPV provides an indirect estimate based on platelet size. A larger platelet doesn't always mean it's immature. Second, it's highly sensitive, meaning it works even when platelet counts are critically low, unlike some traditional platelet counting methods. Last but not least, IPF can be reported as either a percentage or absolute count, offering flexibility with clinical interpretation. Simply put, IPF provides a more precise, real-time snapshot of bone marrow platelet production compared to the indirect MPV result. Now, let's put this into perspective. Who may benefit from IPF testing? Patients with thrombocytopenia. It may help determine if the underlying cause is due to platelet destruction or bone marrow failure. patients undergoing chemotherapy. Monitoring IPF may provide early indication of platelet recovery. Hematologists managing bone marrow disorders. IPF trends may be useful with conditions like aplastic anemia, leukemia, and MDS. For patients with immune thrombocytopenia, IPF may help distinguish between platelet consumption and inadequate production. By incorporating IPF into routine hematology testing, clinicians get a more complete picture of platelet dynamics, providing more comprehensive data for managing patient care. All right, let's wrap things up with a quick recap. IPF measures the percentage of immature platelets in circulation, giving insight into bone marrow platelet production. It may help differentiate between platelet destruction, high IPF, and bone marrow failure, low IPF. Sysmex XN-Series analyzers use fluorescent flow cytometry to accurately detect immature platelets. Compared to MPV, IPF provides a more direct and reliable assessment of thrombopoiesis. When used with other platelet indices, IPF is a valuable tool for managing patients with thrombocytopenia, chemotherapy recovery, and bone marrow disorders. So, the next time you see an IPF result, you'll have a better idea of what it's telling you about your patient's platelet production. That's it for today's episode of Lab Talk. If you enjoyed this discussion on immature platelet fraction and how it's changing the way we assess thrombopoiesis, be sure to subscribe, leave a review, and share this episode with your fellow lab professionals. Got a question or a topic you'd love for me to cover next? Drop me a message, and let's keep the conversation going. Until next time, keep learning, keep questioning, and keep making a difference in the world of clinical science.